Here are a couple reps of the bridge in all its glory. Hi, I'm Chris Porter with Fast Track Physical Therapy and Sports Medicine in Midvale, Utah, and we're going to get cheeky today. We're going to talk about your butt. And one of the reasons we're going to talk about your butt is because it's important. It should be the largest muscle in the human body, unless you have no butt at all syndrome. But hopefully, with some help, you can get back on track with your buns. Almost every activity on your feet, you have to engage your glutes and drive your hip. Walking, running, sports, you name it. So let's get started. Step 1, locate your butt. Step 2, imagine you got a walnut between those cheeks and give it a squeeze. Crack those walnuts. The next step is to find a neutral spine. You want to flatten your back against the table, arch your back, and find a point roughly in the middle. Your spine should look like this, not this. Generally, your feet should be about hip width apart and about 1 to 2 foot widths away from your butt. Alright, so as you drive your glutes and hips towards the ceiling, the seam of your pants should roughly be in line with the seam of your shirt. That way you don't arch too much. And for most people, you really want to try to relax those back muscles. They're located in the lower back all the way up to mid-back. You want to really make sure you're driving through the glutes. It's easier with your hands down. You can progress it with your hands up or with your hands across your chest. But when you remove the weight from your hands, it does put a little bit more pressure on your neck. So just be aware of that. Let's get cheeky again. Let's review. We want to crack a walnut with our butt cheeks, drive through the glutes right here, and relax the hamstrings. There are some progressions where we want to use the hamstrings, but not right now. We want to focus on the glutes and relax the hammies. So the million-dollar question, how high do we go? Well, until your quads get tight. Don't ever try to go past the tightness you feel in the front of your thigh, right here. So one last piece, you really want to make sure to engage your abdominals. So to find your abdominals, you want to try to pull your belly button in, and you should feel tension develop right here in your fingertips. It's right in front of your hip bone. That should get tight as your belly button comes in, but you should still be able to breathe. So don't forget to keep the abdominals tight and keep breathing. Here's a final close-up of the hip drive. And let's transition positions. One of the most common mistakes is to shift your pelvis off center, so just make sure you keep your nose kind of in midline there with your spine. And to progress to one leg, it's easiest to have a 90-degree position of the hip and knee, as shown. But be wary of the drop of the pelvis. When you squeeze your glutes real hard, that will drop. So you've got to make sure you have enough abdominal contraction to balance the power out with the glutes. Now, foot position makes a big difference. Generally, you want your knees over your feet with just a slight gap between your knees. But if you're having some knee pain, you might want to widen up your stance just a little bit. Now, one progression we sometimes use if we want to increase the focus on the hamstrings is to use a ball. So lift at the hips, keeping the knees straight to start. Then bend the knees to roughly about 90 degrees. Squeezing the hamstrings. In this final stage, you really want to drive through the glutes as you have your feet there almost flat on the ball. The hamstrings will work, but you want to really emphasize the glute and hamstrings working together. Okay, for the grand finale, level gnarly. One leg, bridge on the ball, ball curl. 90 degrees at the knee. Drive with the glutes. You can see she can't quite get up as high as she could before, so that tells you she has some room to grow there in her glutes and hamstring strength. But all in all, great job, Sarah. The goals and dosage of these exercises are going to be a little bit different for everybody. Run it by your physical therapist, and good luck.